Chapter 5 of ICD-10-CM is for mental, behavioral, and neurodevelopmental disorders. This presentation will cover the official ICD-10 guidelines specific to this chapter. There will also be clinical scenarios to practice coding what you just learned, followed by a small quiz at the end of the presentation. For each coding example and quiz, you will need to pause the webinar and use your ICD-10-CM coding manual to code the scenario. Once you resume the webinar, we will go over the correct codes, the rationale behind them, as well as how to locate them in the ICD-10 manual. Keep in mind that there may be more than one way to find a code. We are aware that there is a great deal of information contained in this presentation. Therefore, at any time during the webinar, please feel free to pause and replay as needed. It is important that you have already completed the Introduction to ICD-10-CM webinar, as you will use the conventions and general guidelines discussed in the introduction to complete the coding scenarios. As you can see on this slide, the codes for this chapter start with the letter F. If you remember from ICD-9, these codes all started with numbers 2 and 3. However, there are more codes in ICD-10, primarily due to all the new combination codes for substance abuse with associated disorders, which we'll review in more detail. For those in the behavioral health community, I'm sure you're aware that the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, or DSM-5, contains both ICD-9 and ICD-10-CM codes and should be used in conjunction with an ICD-10-CM manual. DSM-5 does not contain the 5 axes of DSM-4. Instead, all conditions affecting the patient should be coded. This means you are no longer required to use the Global Assessment of Functioning scale contained in Axis 5 of DSM-4. The ICD-10 guidelines focus on substance abuse. Therefore, that will be the focus of this webinar. There are now drug and alcohol combination codes that combine substance abuse with other disorders. I also want to point out that since I will be focusing on ICD-10 coding for behavioral health, if you currently utilize the DSM and have not yet been trained in DSM-5, I recommend additional training in this area. An ICD-10 in remission means either the complete stop of alcohol or drug intake for a period of time or a gradual trend towards cessation. If the patient is admitted for withdrawal, or withdrawal develops after they've been admitted, the alcoholism code is reported first, and then the blood alcohol level is reported if known by a code from category Y90. This is a brand new category for ICD-10 and allows for better public health tracking. In ICD-10, the codes for in remission, which are the codes in categories F10 through F19 with 4th and 5th characters of 21, are only to be used if documentation states that the patient's substance dependence is in remission. This is based on the provider's clinical judgment. There is a hierarchy for the terms use, abuse, and dependence when it comes to ICD-10 coding. Use is the least severe and dependence is the most severe. Therefore, when both use and abuse are documented for the same substance, you would only code for abuse. If abuse and dependence are documented for the same substance, you're only going to code for dependence. You're only going to use one code for type of substance, such as alcohol or an opioid. However, it is certainly possible to have one code for alcohol dependence and another code for opioid use on the same claim. In ICD-10, the codes for psychoactive substance use, which are the codes in categories F10 through F16 with 4th characters of 9, are only to be used if documentation states that the psychoactive substance use is associated with a mental or behavioral disorder. The relationship must be documented for a code such as F14.980, cocaine use unspecified with cocaine-induced anxiety disorder. For sequencing of substance abuse or dependence codes, if a patient is admitted for detox or rehab, or both detox and rehab, and withdrawal or other psychotic symptoms are also documented, the substance abuse or dependence should be coded first. If you know the blood alcohol level, a code from category Y90 should follow. If the patient is admitted for both drug and alcohol abuse or dependence, either condition may be coded first. If the patient is documented as having substance abuse or dependence and is admitted for a medical or physical condition related to the substance abuse or dependence, the physical condition would be coded first, followed by the substance abuse or dependence code. It's easy to remember this rule if you think of the scenario in terms of what is the reason for the encounter or admission. Unless the guidelines specifically state otherwise, follow this rule when coding. Now let's try an example. A 30-year-old female presents to the clinic requesting assistance for cessation of chewing tobacco dependence. She has been a chronic user since age 15 and is now motivated to quit. Counseling on the options for chewing tobacco cessation was provided to the patient. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. Our first code is Z71.6, Tobacco Abuse Counseling. Since the reason for the visit was for counseling, this code should go first. You would locate this code by going to the term counseling in the alphabetic index and then locate tobacco use indented below, which points to code Z71.6, which you would then confirm in the tabular. When you do, there's an instructional note which says use additional code for nicotine dependence, which is category F17. Therefore, we know our next code has to be from category F17, which is why it's so important to confirm all codes in the tabular list. However, I want to walk you through from the beginning as to how to get to F17.220, which is nicotine dependence, chewing tobacco, uncomplicated, for our second code. In the alphabetic index, start with the term dependence. Indented below is the term tobacco, which states next to it, see dependence, drug, nicotine. Therefore, you would go to the term drug under dependence and then find nicotine indented below. Since documentation states that the patient presents for chewing tobacco cessation, you want to find chewing tobacco indented below nicotine. This points to code F17.220, and after reviewing this code in the tabular, it is apparent that this code for uncomplicated is the most appropriate. For our next example, we have Martin, a 55-year-old male, seen in follow-up for treatment of alcohol dependence. As a result of his drinking, he is also on medication for chronic alcoholic gastritis. He also has a history of cocaine dependence. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. Our first code is F10.20, Alcohol Dependence Uncomplicated. Since the reason for the visit was for follow-up for alcohol dependence, this code should go first. You would locate this code by going to the term dependence in the alphabetic index, then locate alcohol indented below, which points to code F10.20. After reviewing this code in the tabular, it is apparent that this code for uncomplicated is the most appropriate. The next code is K29.20, Alcoholic Gastritis Without Bleeding. To find this code, go to gastritis in the alphabetic index and then find the term alcoholic indented below. Since there is no option for chronic listed, you would use the code for the alcoholic gastritis, which points to K29.20. After confirming in the tabular, this code is most appropriate since documentation does not state that the patient has bleeding. Therefore, the default is without bleeding. Our last code is F14.21, cocaine dependence in remission. In the alphabetic index, you would start with the term history and then find the term personal indented below. Under personal, there is an option for drug dependence with a note that states see dependence, drug, by type, in remission. Follow these instructions and look for the term cocaine under dependence. Under cocaine, look for in remission, which points to F14.21, and then of course you would confirm this in the tabular. I would definitely code this condition last, since the dependence is in remission. It is not a current condition, nor is it the reason for the visit. Let's do one more example. The patient was brought to the ED and then admitted because of acute alcohol intoxication. His blood alcohol level was 22 milligrams per 100 milliliters. He has been drinking since he was 13. The discharge diagnosis is acute and chronic alcoholic continuous. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The first code is F10.229, alcohol dependence with intoxication unspecified. Since documentation states that the patient was admitted because of acute alcohol intoxication, start by looking up intoxication in the alphabetic index, then find alcoholic indented below. However, there is a note that states see alcohol intoxication. You would then find alcohol in the alphabetic index and intoxication indented below. Indented below intoxication is the term with, and then dependence indented below this, which points to F10.229. It is appropriate to select the code for dependence because documentation states that the patient has been drinking since he was 13 and is acute and chronic alcoholic continuous. When you confirm in the tabular, this code, which is unspecified, is the most appropriate because we do not have any documentation which indicates the patient has delirium or that this is an uncomplicated case. Our second code is Y90.1, blood alcohol level of 20 to 39 milligrams per 100 milliliters. If you happen to look at the beginning of category F10 for the first code, there is an instructional note to use additional code for blood alcohol level if applicable, which is category Y90. However, if you didn't see this note, in order to code blood alcohol level, you would actually go to the index to external causes, which for the Optum 2015 ICD-10 CM Expert for Physicians starts on page 387. You would then look for blood alcohol level, which has a range of 20 to 39 milligrams per 100 milliliters indented below, pointing to code Y90, which you would then confirm in the tabular. When you confirm this code, you'll notice there is an instructional note which states, code first any associated alcohol-related disorders from category F10. This would be helpful in the event you had wanted to code the blood alcohol level first. In fact, none of the codes in the external causes of morbidity chapter, which is chapter 20, where this code comes from, would be coded first. Now it's time for our quiz. Our first question is, what code is assigned for psychological pain? Our second question is, if a patient has both substance abuse and dependence documented, what should be coded? Our final question is, true or false? The drug and alcohol codes are combination codes that identify many various details about the encounter. You can pause the webinar to write down your answers and then hit play to find out if you were correct. The answer to our first question is F45.41. This code is located by going to pain in the alphabetic index. However, there is no option for psychological indented below pain. The closest word is psychogenic, which points to code F45.41. I decided to look this code up in the tabular, and sure enough, the code description is pain disorder exclusively related to psychological factors. This is an example of when the tabular list is our friend. The answer to the second question is dependence only. Remember that the hierarchy has use at the bottom, then abuse, and then dependence. Only one term is used per type of substance. Our third answer is true. The drug and alcohol codes are combination codes which include substance use, abuse, or dependence with conditions such as withdrawal, intoxication, or anxiety. Remember, the United States will begin using ICD-10 on October 1st of 2015. After the October 1st compliance date, it will be very important to verify that claims are being received and to check remits for denials based on the ICD-10 conversion. This concludes Chapter 4 of ICD-10-CM, Mental, Behavioral, and Neurodevelopmental Disorders. Please feel free to check out our webinars on all 21 chapters of ICD-10-CM. If you need further assistance with ICD-10 training for physicians and/or staff, please visit the VantagePoint website at www.vantagepointconsult.com or call us at 203-288-6860.